This is a total imaginary story from the 90s. Maya is a healthcare worker who stays in a small town. But she needs to visit the village nearby to give health services mainly to women and babies. She is the only woman in this area who doing this job. There is a very low number of doctors in the village and people are not getting the healthcare they need. So Maya is their only go-to person. Maya is experienced in doing most of the small health jobs. But what she mostly does is checking BP, giving vaccines, injections for minor sickness. Most of the villagers want injections, otherwise they think no medicine is given. In fact, Maya also gives injection most of the time as the villagers can't take the pills timely. This is of 90s when there is not my digital things happened in villages. Actually, the places Maya works don't even have electricity, let alone any other modern things. Even a wall clock is luxury to these people. Most of the men are either farmers or laborers. However, the villages are very peaceful. Maya usually go to one of the houses in one village in a weeks, and then most of women gather to that house to get medicine and treatment from Maya. In case of emergency, she goes to others' house. This is one of the stories of Maya's daily life. Before we start, Maya is a 35 years of old married woman with a 1-year-old son. She is 5'2" and around 80 kilograms of weight. She travels to the villages on rickshaws pulling vans and carries an umbrella due to the sun. Sometimes she has to walk a lot. She likes her jobs very much and mostly likes to poke women with painful injection. Giving 5 to 10 injections is her daily work. She carries a medium-sized leather bag that she hangs on one shoulder. Inside that she has some bottled medicine, usually vitamins, irons, saline injections, penicillin and distilled water, also a glass syringe with metal needles of different size and thickness in a blue box, cotton, alcohol, gauge, dressing pads and a BP meter with stethoscope. She most of the time wears sari and blouse with very short sleeves that just cover the top side of arm, and almost most of the arm is open. When she raises her hands holding the syringe upside to remove bubbles in her eye level, one can slightly see the curve of her armpit. She has fleshy arms with 2 big vaccination scars on left from smallpox vaccines, and 1 small on right arm from BCG vaccine. She is not super beautiful, but she is attractive with her figure, and she knows how much to show off. She intentionally wears a little ultra-modern dress, which is not of a thing in village, as they give her respect for her audacity. You can imagine being a working woman in the village in 90s. It is difficult to perform the job outside unless you show some intimidating personality. Maya knows that, and she kind of has all of that with her body appearance and attitude.